For a health service already buckling, it was supposed to be an innocuous technical tweak of pensions. But it stopped some 100,000 GPs and hospital doctors taking on extra shifts. It heaped pressure upon pressure. Now today the government has got the message. It's announced a drastic overhaul of a once trumpeted George Osborne pension wheeze.
What is happening now is goodwill has been eroded, and the pension uncertainty and the unfairness of it has impacted on our waiting list, because the overtime that people were happy to do previously, why would you do overtime and actually pay to go to work?
The Hospital Consultants and Specialists Association says 70,000 hospital hours per week have been lost because of this pension problem. A tapered annual allowance introduced in 2016 by then-Chancellor George Osborne means most people can save £40,000 into their pension each year, tax-free, if earning a £110,000 salary. But as they earn more, their tax-free pot of £40,000 reduces on a sliding scale to £10,000. This means that taking on more shifts may bring in more income, but it also brings a higher pension contribution and so a higher tax bill. In one case, a doctor received an additional £16,000 over the year, but then got a tax bill for almost that exact amount. This radiologist felt she had to refuse extra shifts to avoid a big bill.
Previously, I've been doing waiting list initiative clinics, so coming in at the weekend or in the evenings to do additional clinics so that patients with suspected cancer could be seen quickly. I've not done those for 2.5 years, and many colleagues are in a similar position.
Now the government is expected to let clinicians lower their pension contributions.
The action we take today will mean that doctors will be able to get properly rewarded if they work flexibly and if they go the extra mile and do that overtime. That's good for them, but it's also good for the NHS and it's good for patients.
The government is thought to be clearing the decks for an autumn election, obviously on the subject of Brexit, but probably about the NHS too. But many in hospitals around the country think this winter will be worse than previous winters. And with these changes to pension reforms not coming in until April next year, the government's got much more work to do if it really wants to be the party of the NHS. The health service has long relied on staff doing extra time. Now at least they stand to be compensated for the extra work they take on, if not the extra strain. Allegra Stratton, News at 10.